Hi everyone, welcome. I'm Dr. Kelly Morgan at Cardiff University. So welcome to this webinar on energy drink and sugary drink consumption among young people in Wales. And this is really an opportunity for us to share insights from data collected within the school's health research network, and also to highlight some of the wider evidence and resources available to you. I'll begin the webinar by highlighting some of the key policy and practice pieces within the broader arena, some of which you might be familiar with. And then I'll highlight some of the recent literature and earlier trends on energy drinks and sugary drink consumption among young people, with a particular focus on our population in Wales. I'll be sharing more of the recent data that we've collected within the school's health research network. And throughout, I'll highlight the broader implications for young people's health before highlighting some of the school-based policies and practices and broader wellbeing initiatives that might be useful in your roles and your school settings. So if we were to reflect on the last 3 years or so, you might consider that we've been made more aware of the concerns and the levels of young people's drink consumption, particularly around energy drinks being reported in the media and at the forefront of policy discussions. So, for example, in 2022, Welsh Government announced a consultation on the ban of energy drink sales to under 16s, and also introducing regulations to limit hot food takeaways near schools. And this is part of obesity prevention efforts. This consultation was welcomed by a range of organisations, so including the Royal College of Paediatrics and Child Health, and whereby responses have been raised with regards to various health-related concerns around energy drinks use. So since then, in 2024, Welsh Government published the responses to their ongoing consultation activities, and we've seen various plights for action. So, for example, academics at the University of Sheffield, shown here, around concerns of tooth decay, and also broader news pieces highlighting health-related concerns. If we keep our focus on energy drinks for a moment, we might consider them as brightly coloured drinks, well placed around supermarkets. So as shown here, there's often these grand stands placed at checkouts. For a lot of these drinks, they're provided at very low prices. But what are some of the main concerns about young people drinking energy drinks? So the broader literature has shown associations between energy drink consumption and tooth decay. There's concerns around weight gain and obesity. There's also this increasing risk around type 2 diabetes, and also evidence around how consumption can disrupt sleep and induce anxiety. There is some evidence which is pointing towards heart health risks. Addictive consumption patterns are also noted among the literature. And in a broader sense, there's also a wide evidence base looking at the misinformation and the mixed messages around young people's consumption of energy drink use, and maybe kind of the broader role it has in terms of supporting health and well-being. More recently, there's been a systematic review published of all the latest evidence around consumption of energy drinks by children and young people. So published in 2024, and essentially findings echoed the earlier evidence base. So showing clustering of behaviours such as smoking, alcohol use, binge drinking, substance use, associations with sleep, also education around poor education outcomes in relation to energy drink consumption, looking at adiposity, so higher average body mass indexes amongst those drinking higher rates, and flagging the evidence around negative mental health outcomes. And while one has to be cautious in interpreting the evidence base here, and a large majority of studies included were of cross-sectional design, the particular paper does conclude that results strengthen the existing evidence around adverse effects of energy drinks consumption. And again, it's kind of bringing that plight towards policymakers to make evidence-informed changes. If we turn our attention now towards the trends in our school's health research network data, here I'm showing a previous paper which we published, which looked at trends in consumption from 1998 right through 2017. And what we found earlier was that daily consumption of energy drinks remained quite stable across this time, so 6% reported daily consumption, whereas weekly consumption had shown a steady decrease over the years. So around 15% were reporting weekly consumption in 2017. And in terms of demographics, our earlier data showed higher consumption rates amongst boys, older children, and those young people from the lowest socioeconomic group. Looking at our most recent data, so gathered in 2023 from learners across primary schools aged 9 to 11, we found that 86% of them reported never or less than weekly consuming energy drinks. 11% reported weekly consumption, and 3% were actually reporting daily consumption. And similar to our earlier findings among secondary school pupils, boys were found to report higher levels of daily consumption compared to girls, and that was true when we looked at our 2021 data and also data from 2023. For secondary school aged learners, so 11 to 16-year-olds, 2023 data showed just under 80% reported never or less than weekly consuming energy drinks. 17% reported weekly consumption, and 5%, so a little bit higher than primary school pupils, reported daily consumption. And here we saw a difference with sociodemographics. We found that girls have now started to report higher levels of daily consumption compared to boys. And that was true of our 2021 and 2023 data, which is also something which is contrasting to wider trends in consumption amongst other countries. Here we're showing a graph which is pulling all of that data together, so from 9 to 16-year-olds and across 2021 to 2023, so you can see what the trend lines look like. And as shown here and indicated, we see a slight increase in daily energy drink consumption around about the 6% mark. So if we cast our minds back to our earlier trend data in 2017, this is just slightly higher, jumping from 5 to 6% daily consumption reports. So if we now turn our attention towards reports of sugary drink consumption, here we can see two graphs. So one showing reports amongst primary learners and one showing reports amongst secondary age learners. So first of all, looking at the primary aged graph, we can see that approximately 10% of learners are reporting never consuming energy drinks. And if we look at the kind of light dotted lines, so the top line, we can see that just under 50% are reporting frequent consumption. So that's roughly 2 to 5 or more days a week. Whereas in the middle line, around 40% are telling us that they're consuming energy drinks occasionally, so less than 1 day a week. So quite a high proportion overall are reporting frequent consumption. Similarly, across looking at the secondary age learners, we can see again 10% never consuming sugary drinks. Here we can see that roughly 35% are reporting occasional consumption, but now we're seeing higher levels of frequent consumption. So between 50 to 60%, so roughly 58% in 2023, are reporting drinking sugary drinks 2, if not up to 5 or more days a week. When we looked at the SHRN data for sugary drink consumption and association with demographics, we saw that boys are reporting more frequent consumption of sugary drinks compared to girls. We found greater reports amongst older age groups. And we also found that consumption reports did not differ between the low, medium, and high affluence socioeconomic groupings. And these findings are largely consistent with the broader literature. Today, I've been sharing an insight into our school level data across the primary and secondary school settings. But if it's of interest to you and you want to have a look at wider data, whether it's across your health board or across your local authority, you can use the Public Health Wales National Observatory tool, whereby you can break this data down according to year groups, according to genders and areas. And that's very much publicly available for you to have a little more of a delve into the data, and whether that be about sugary drinks or energy drink consumption. And you'll also see a number of other health behaviour data there that you can take your time to have a look through. So given that our data is showing that approximately 1/5 of all learners involved in the SHRN surveys are reporting either daily or weekly use of energy drinks, and approximately half of all learners are reporting frequent consumption of sugary drinks, what is it schools can do to support young people and reduce consumption? So here is a recent article which has been looking at the effectiveness of schools-based approaches for reducing sugar and sugar-sweetened beverages amongst children. So this is published in 2025 by Malhotra and colleagues. And there's a link here to read more about it. But essentially, the article shows promise. So it's showing that interventions conducted in schools are showing effective impacts in reducing sugary sweetened beverage intake. Key findings of this paper show that those interventions which had the greatest impact on consumption rates were those interventions which targeted various levels of social influence. So, for example, targeting peers and the school environment were found to be more effective at changing health behaviours rather than those approaches which are merely aimed at the individuals. The paper also highlights how physical activity interventions in combination with screen media use approaches helped reduce sugary drink consumption. Approaches around modifying the school environment and using the curriculum were also shown to be effective. And the paper also highlights examples around nutrition education, practical workshops, family activities, and health psychological approach-based education as a way to which reported consumption was shown. In terms of broader resources for your schools and in your roles which you can draw on, there's an imminent toolkit being produced by Public Health Wales, which should be released any day, and that's really to support school practitioners to help young people reduce consumption rates and be aware of some of the health concerns with drinking energy drinks and sugary drinks, for example. There's a helpful fact sheet around sugar and health by the British Dietetic Association. And there's also some more broader links from the NHS and supporting younger populations within primary schools. And I've also added in here a video which has been co-produced by young people as part of Lancashire County Council. And it's quite an interesting video. It's young people rapping about rethinking your drink when reaching for an energy drink. So I've added a link here for your leisure and for you to consider maybe whether you'd introduce this within your school setting as part of an education tool. And finally, just to highlight our next steps. So our team at SHRN will be in touch to let you know when the Public Health Wales Toolkit is available, as I'm sure your Healthy School coordinators will also. Our team is in the process of gathering to analyse the 2024 data gathered from primary schools. So that will be looking at a much larger sample of responses from young people. So we can have a little look to see whether these trends in reports for energy drinks and sugary drinks are kind of holding true. And we're also continuing to gather example case studies from schools across Wales. So if you feel like that you would like to put forward a case study example, particularly here in the area of energy drinks or sugary drinks, and share some of your amazing best practice, then please do get in touch. Otherwise, diolch yn fawr pawb. Many thanks for listening and joining today. Please do get in touch if you have any follow-on questions. Thank you.